Welcome back to General and Housing, and we are resuming testimony today, Thursday, April 10th. And we're going to have a pair of witnesses on disability housing. And Susan, you want to introduce yourself and take it away? This is again, we're taking testimony on S-127. The analog to our housing bill is the Senate housing bill, and the Senate housing bill, we're focusing on the issues that were in the Senate housing bill that were not in ours. Go ahead.
Thank you. Good morning, Mr. Chair, members of the committee. For the record, my name is Susan Aronoff. I am the Senior Planner and Policy Analyst for the state's for Vermont's Developmental Disabilities Council. And so that's a mouthful. I haven't been before your committee, so I'd just like to take a couple minutes to break this down for you.
Well, actually, why don't we introduce ourselves?
Oh, super.
And go ahead.
Good morning. My name is Elizabeth Burrows, and I represent Windsor One, which is Heartland, West Windsor, and Windsor.
Morning, Susan. I'm Mary Howard, and I represent Rutland City District 6.
Good morning. I represent Colchester, Chittenden 20,
Okay.
Gal Petal.
Debbie Dolgan, I represent St. Johnsbury, Concord, and Kirby.
Hi, I'm Tom Charlton, represent Athens, Chester, Grafton, and Linden.
Okay.
Joe Parsons, Newbury, Thompson, and Groton.
Dodge, Essex County, City of Essex Junction.
And I'm Mark Cavalli, and I represent Callis and Plainfield and Marshfield. Welcome.
Thank you. So it's a pleasure to be here. At the start of any testimony I give publicly, I always have to give this disclaimer. So I am a proud state employee. However, I'm a very rare state employee. I am covered by a memorandum of understanding between the Agency of Human Services signed by Jenny Samuelson and my office. And that is because every state has a developmental disabilities council. And so do 6 territories. There are 56 in total. And we were created under a federal law, the Developmental Disability Civil Rights Act. It's all cited in my testimony. And we exist for the sole reason to give people with disabilities and their family members access to the places where decisions about them are made. And so you see me around the State House with members of my council and people in our training programs and leadership training. And that's because the council I work for is made up of 60%. This is required by federal law. The majority has to be people with disabilities and their family members. And we're entirely federally funded. Of all the councils in the country, we're a rare one that's entirely federally funded. And that was a decision our council made years ago so that I and other people who've had this position before me never have to come to the legislature and say, could you fund our salary? No, I'm here to talk about the needs of.
Let me just ask you one question.
Yes.
Do you have any idea whether you're still funded?
Well, good question, Mr. Chair. And I was
going to ask because we've been taking testimony here on the effect of federal funding cuts, which are speculative, but nonetheless.
Yes. So Vermont punches above its weight in that my executive director, Kirsten Murphy, is the chair of the board of the 56 councils that I mentioned. There's 56 executive directors in the country. So that there's an organization, the National Council of Developmental Disability Council, the NACDD, that's been meeting daily. And my executive director is the chair of the board of all these 56 councils. And our programs moved the Make America Healthy Again order that shut down a lot of programs in Health and Human Services, moved the agency that we respond to, the Administration of Community Living, all over the place. So far, councils are still intact. And that's because, like I said, we were created by a federal statute. It would take an act of Congress to get rid of us. Our funding, on the other hand, it's hard for me to do the job I do and then go and ask Jenny Samuelson or the government to cover our salaries, but that's what other councils are doing. We haven't done that yet. So my position's entirely federally funded, whether or not it be funded after July, October, don't know. Really, that's not what I'm here to talk with you about, but thank you for asking. What we're really worried about for our folks are the HUD, the cuts to HUD. So the planning team I'm gonna talk with you about, prior to January 20th, had received an accelerator grant. The state of Vermont was in a cohort that was gonna bring together the Agency on Human Services and the Vermont Housing and Conservation Board and all the right people. And they didn't come with money, but HUD was gonna bring them to Maryland with 6 other states to talk about how to develop this exact kind of housing that I'm here to talk about, service supported housing. That accelerator grant, we understand, is on hold, whatever that means. But the parties want to go forward. And so that's a great segue to this planning team that's in this bill. Originally, the planning team was going to be the members of this accelerator grant, but we still want to bring them together to do the work that needs to be done. So anyway, I'm here on behalf of the Vermont Developmental Disabilities Council because of the memorandum of understanding. I'm free to take positions, whether they align with the governor and the Secretary of Human Services or they don't. I'm housed in the Agency of Human Services. We're often urging them to do more, do things differently. We know they have limited resources.
Just by the way, for the committees and public, this, the subject matter here is section 5 of section 127, which is called State Housing and Residential Services Planning Committee Report, which you can find at page 13 of the bill.
So what's really interesting for me being here is that I'm in the Housing Committee and usually I'm in the Human Services Committee. And the work that we've been doing with service supported housing, I have to be honest, started in the human services side. So I'm going to be talking about an act called Act 186 that passed in 2022, but that started in House Human Services. So why am I here talking with you guys? Because what we've realized in the Developmental Disabilities Council is we need housing. So we can have all the services we want, but unless people have a place to live, it's not going to work. And what we really have to do, the opposite of that is true too. You can have all the bricks and mortar and all the housing, and unless there's services, it doesn't work. And so what Section 5 does and what we're looking for is a state level planning team. So what problem are we trying to solve? Where have we gotten to? In 2022, the legislature passed Act 186, and Act 186 commissioned a report. It's attached to the testimony that I filed. I have a paper copy here. I know you guys read a lot, but I really encourage you, if you have any time, read the conclusions, read the overview. Bottom line, Vermont needs 604 units of service supported housing for adults with intellectual and developmental disabilities, and that was in 2022. The good news is other states have figured out how to do this, and that's what this report looked at, was the questions the legislature asked at the time were, tell us what Vermont needs, tell us what other states are doing, tell us what works. And so Allison Hart was commissioned by the Developmental Disabilities Council and Green Mountain Self Advocates to prepare this report. Highly recommend. Not the best bedtime reading, but I looked at it last night before I went to bed, and I was encouraged to know that there are models out there that are working. And one of the things that we know works is when you can bring together the state level partners together in a planning team. And so the place that we got to after this report, the Act 186 also launched 3 pilot grants. You supported funding for the 3rd pilot grant in budget adjustment, and you supported in the budget. That's the 2.8 million that was going to the Champlain Housing Trust to build 10 units of housing in Burlington. the message we've gotten from the legislature loud and clear.
Remind me, I just,
Yes.
sorry to interrupt. My memory is that 2.3 million was in the BAA, which is nowhere. Is it in the budget?
Yes, so the good folks on House Appropriations Committee put it into the one times, I want to say it's like X or somewhere, but anyway, it's going through the HCB to complete the Act 186 pilots. You won't find the word disability anywhere you can control F the budget. It's not, it's the 186 pilots, and that's how it's referred to. So that's a beautiful thing. And we thank you for your support, and we thank you for your support of some policy changes. So the other work that was done by previous legislatures was you created a pipeline to develop this service-supported housing, and you've charged the Vermont Housing and Conservation Board with developing this kind of housing a priority. So right up there with housing unhoused people, refugees, farm workers, is housing this folks, adults with disabilities. Problem is, it's really hard to do. It's really hard to do one-off projects. The message after the 186 pilots, we're getting through the funding hurdles, is you can't do these one-off. The other message, loud and clear, is it can't all be public funding. We need to develop public-private partnerships. And that's what has been successful in other states. And if you read this, you'll see that there have been state partners that bring together. And that's why our planning team is going to include treasurer. There have been states that have created governor's funds. There's untapped mechanisms, untried actions that have worked in other states. So that's the purpose. And why does this matter so much? So a little bit of background about the problem we're trying to solve. 600 units of housing for who? These are adults. These are adults living with their parents mostly. You've met the parents. They're like my age, in their 60s, in their 70s. They're terribly worried about what's going to happen when they're gone. Who's going to care for their loved ones? Their loved ones are sometimes adults with high support needs that haven't fit well into Vermont's shared living model. And by the way, Vermont's shared living model now has like people in the hotel program because we don't have enough shared living providers because Airbnb and a billion other reasons. So anyway, what the legislature recognized was we need a pipeline. Now we're at the point of needing a plan. And I was about to say why for these specific people. And the reason is that prior to 1993, a lot of the individuals that we're talking about would have been housed at the Brandon Training School. And in 1993, Vermont became the second state to close its institution that served people with disabilities. And I often say we were the second state with pride, as if we closed it because it was a good idea. Not true. We closed it because just like Woodside, lawyers acting on behalf of the residents of the institution said, stop, people are being harmed. This isn't right. And who was the leading lawyer at that time? Was a 20-something-year-old lawyer named Sally Fox, who went on to become the great Senator Sally Fox. And so I'm here on the shoulders of giants. And the time Brandon was closed, the governor and the legislature, it was then Governor Dean, made a promise to the people then living at Brandon and to their families that Vermont would always serve the people there in the communities that they came from, in real homes, with real families, with real lives in the community. Vermont has not kept that promise. You don't have to ask me. CMS, the Centers for Medicaid and Medicare Services, has found Vermont to be out of compliance with the programs that serve people in the community. And so one of the things I referenced in the written testimony is this plan of correction Vermont has been under because they don't provide enough housing choices for this group of people with disabilities. And so we have moral reasons, legal reasons. The United States Supreme Court in the case of Olmsted, found that for people that the state is paying to serve, paying for the care of, if that care can be provided in a community setting, not an institutional setting, and that's the person's choice, then they need to be served in the most integrated setting. So that's a Supreme Court ruling that we're not complying with. There are Medicaid rules we're not complying with, et cetera. So the point that we're at now is I feel like there's been a real commitment from the housing side. The Vermont Housing and Conservation Board has funded projects since the pipeline language was put in. And now we need a plan. We can't keep doing these one-offs. We need to bring the right people together and have a plan, an actionable plan by November. We tried to keep the committee small, and in that sense, everyone except for the representatives from the parents group and from Green Mountain Self Advocates would be paid to be there, so there'd be no stipends. The essential stakeholders, I don't want to leave them out, but I think it can be a small, effective planning team of mostly state actors. And then we were looking for an actionable plan by November. And I understand there's some question about why is it getting support from Ledge Council? And I think that's because the original language was that they'd produce legislative language by November 15th. And that's why there's a senator and representative on the committee, so that we're really talking about something you guys can act on next year.
Questions? Go ahead, Tom.
When you reference 600 unit, are we talking beds, multiple, how many people are in the unit?
Yeah, so it's really 600 people. And so one of the things, that's a really good question, thank you. So one of the things that we're looking forward to is in Act 186, the charge was to come up with a plan for housing that would actually pass muster with these home and community-based rules that I was mentioning. It's a subtle difference, but an important difference here. We're not necessarily looking for individual housing. One step in service-supported housing Vermont entirely skipped was group living. And so if you think about things like recovery residences, which went from idea to populated in like less than 5 years, Vermont skipped for good reasons at the time, but now it's not like other states, the group home model. So what a lot of people are looking for are peer resident opportunities where they can live with their friends and have a house that staff come in and out of, or maybe, live in also, but they don't have to move. They have a home. Vermont has so few group homes, and therefore very specific populations,
But is it 600 people or 600?
600 people.
600 people. So it could be part of, for some sorts of people with certain disability levels and disabilities, the group home works. With others, it doesn't.
Right. And some people want to live. So what's really interesting about the pilots, and this just shows like there's not going to be one model that's going to fit all. One of the pilots is what's called an intentional community. It's in Moncton. It's called Riverflow. I'm looking over here because Representative Casey Elder, who is from Moncton, used to sit over there, and he was really into this project. And one of the other projects is going to be apartments in downtown Waterbury with, services and support. And some people want to live independently in an integrated, downtown setting where they can walk to things. And that's the Waterbury and Burlington model. And some people want to be out in the country. So, and Vermont has a mix, but what Vermont doesn't have, it's almost like the missing middle in the other housing. Our missing middle is peer residences, intentional, They don't have to be 15, 20 people, but Vermont has a 2-person rule right now. That's a real obstacle. The other charge of this planning committee is to we've identified that coordinated entry becomes an obstacle to housing these exact people because they will never be homeless, because they get put into nursing homes or other places, kept in hospitals, because they are too dependent on their equipment and their staff to ever be homeless. So they'll never be at the top in the court and entering. That's a riddle we'd like this group to solve. And then the other one just left my brain, but we've identified obstacles. Oh, the two-person rule. When the projects from Act 186 came before Vermont Housing and Conservation Board seeking funding, it turned out to be some very expensive housing to develop because there's a limit right now. Well intended, but it's self-imposed. It's not a federal limit, it is a state limit that you can't serve more than two unrelated people in the same house in the shared living model. So we have effectively capped our group living options really at two.
Thank you. Question?
Can you give us the historical context of that decision?
Of why
Why was it maximized to two? Was it capped at two because there was like negligence happening or crowding or?
So that's really an interesting question. So the shared living model that we talk about, you'll see ads from like Howard Mental Health or Washington County, like looking for a home for a well-mannered gentleman who likes race cars or whatever. That's how we are currently trying to house our adults with disabilities. Sometimes like that's a good way to find a home for a puppy. Sure, it's such a good way to find homes for people. But the shared living model, what it's known as legally is adult foster care. So these people go into other people's homes where people receive tax-free stipends to provide room and board. And people have their social security benefits or other benefits used also to support that living. There's been efforts over the years to increase the rights of those people. So under federal law, they're supposed to have rights equivalent to what a tenant would have in Vermont. We haven't done a great job of enforcing. We're out of compliance with that federal rule too. But even if we were in compliance with the rules, we're having a really hard time finding the providers. But the reason for the cap was to prevent those adult foster care people from becoming group homes. So they're limited to having two people under the same program. Sometimes in special circumstances, you'll see three because maybe one is a child foster care and the other two are DMA. So, but that was the reason. And it's a system right now that when you Google, the Medicaid fraud and residential abuse unit, it's not good. And there's just not enough eyes on and people are getting hurt.
So just to clarify, sorry to, so that cap on a very specific situation, which would have been somebody taking in individuals to their home and being a sort of a foster care provider and family member, whatever. And that has been imposed on the building of
Yes.
what could have been a peer model.
Yes.
Resident models.
Yes.
Because we kept it in the situation of a non-professional who offers to take in somebody,
Yes.
that cap.
Yes. And so then the next tier up, what the folks who developed Riverflow in Moncton had to do was go full on like assisted living, like sprinklers and just thousands and thousands of dollars of renovations.
Let me interrupt for just a moment here.
Yes.
For you guys, we have one, this testimony is not done, then we have one additional witness. So it's probably 10 or 15 minutes at least before we need you.
Okay, great, thank you.
So I just want to note that Gus Seelig and Polly Major from VHCB are here. We could speak more to what happened when they tried to fund these. But the good news is that our council and some staff from VHCB have been getting together regularly and now trying to bring in the good folks at AHS. So we've started some of the work of this planning team, but we've been zeroing in on what can we do about that two-person, because it is self-imposed at the agency level.
Gail?
Who does the screening to determine the entry outcome?
Who does the screening of
To
the,
determine What people go with what people?
Sure. So the way that's a really good question. So the designated and specialized agencies in the state, like Howard Mental Health and Washington County Mental Health, and some of the specialized services agencies serve the whole state, like Champlain Community Services, Upper Valley Services. Currently, the way the system works is they do intake and eligibility, and so
They
people
meaning,
apply-
and what's their
the
credential?
of the staff
Yeah,
doing that?
yeah.
Very good question, but it's in transition. My understanding is it'll soon be state employees doing some of the eligibility determinations, which is what happens right now for choices for care. So there's a department for disabilities, aging, and independent living, and they oversee the services for people with developmental disabilities. And of, let's say, the 86,000 people in Vermont who may have a developmental disability, very few, like maybe 5,000, will ever qualify for services. To get services for an intellectual or developmental disability in Vermont, you have to meet, it's currently like an IQ test and for some people and.
Do you know that
history-
number? What that number is? Like under 76? so-
Yes, and then there's like a margin of error of 5, so I
Right.
think it's 69 plus 5, but don't remember that. I
Okay.
did write a amicus brief on this very topic, but it's out of my brain right now, sorry. But there's an eligibility process, and then added on to that, and this is where housing comes. Of that number, very few will ever be eligible for housing because you have to be homeless or at the risk of homelessness. And so what really good case managers will sometimes tell families, like the families you've all been meeting, and you have to say you're gonna kick your kid out. Put that in writing, and that's how people get housing.
Right.
That's the current system. And in a way, it makes sense because there's not enough to go around. So you'd only house the people who are homeless or at risk of homelessness. But that's why you have 40-year-olds living with their 60-something-year-old parents.
Elizabeth?
Totally eligible, except no help.
Sue, just to clarify, you said the 2-person rule. So it's not a law, it's a rule.
It's right. It's in the regulations of, so
The
within,
agency.
yes. I would need someone from Dale here.
So just so it's the, what is it, the LCAR, the Legislative Committee on Administrative Rules.
Yes,
They made the rule.
They reviewed it.
they reviewed it.
Reviewed it.
Yes.
Okay, so
And-
it's
but it's
not, in other
been-
words, it's not, I'm just clarifying that it's not statutory. It's a rule that can easily be changed.
Yes.
Okay.
It's a rule that can be changed easily.
Well, right. Right.
I have one question, and then I think we have to move on, if I might ask the committee members, if that's okay. I'm looking at the draft, and I'm looking at the membership, and one of the members is the council, the executive director of the council. And one member is appointed by the Development Disabilities Housing Initiative.
Yes.
That.
Oh, I'm so glad you asked that question. So the Developmental Disabilities Housing Initiative is a grassroots group of over 120
That's the parent group, okay.
They bake cookies.
Yeah.
I call it cookie advocacy. But they've been coming to the State House a couple times a month, some family members. And they've been organizing for a couple of years all over the state. And I think they've been doing an amazing job. Somewhere in your records, I didn't bring one with me today. You have kind of what I call their family album, which has stories, pictures and stories of many of their families.
Right.
And each one of them would be like enough to be like, okay, I can't read enough.
Right.
I hope you read them.
I'm assuming, am I right, that the reason, I mean, one of the things I wondered about, you know, how you talked about something we've heard here before, which is that we have this crisis as the parents who take care of these people age out and they can't do it anymore. And I was wondering, why isn't this just something that's been always a rolling case going on? And the answer is Brandon and the closure of Brandon. I get
Exactly.
it. All right.
Right, 30 years.
Yeah.
Okay.
Right. Any other questions of Susan? Susan, 1,000 thank yous.
Thank you.
Thank you.
Our next witness will be Polly Major, Director of Policy and Special Projects at VHCB.
It's actually we got.
What? It's going to be Gus. Gus Seelig, the Executive Director of VHCB.
Like, Ollie, I'm gonna join. Yeah.
Do you want another chair?
Oh, I can sit right with.
Why don't you both introduce yourself, but you both know the committee, so we're not going to introduce ourselves.
For the record, Gus Seelig, I'm the Executive Director for the Vermont Housing and Conservation Board.
I'm Polly Major, the Director of Policy and Special Projects for the Vermont Conservation Board. Give me a second, I will share my screen.
So very briefly, and I have only 5 slides that are to share with you today. The board, with all of the one-time funding, was not specifically asked, but generally asked, and has always had a track record of providing a variety of different kinds of supportive housing. And I think, as Susan indicated in her testimony, the work here really begins with the closing of the Brandon Training School, the litigation around that, and a fundamental promise that money would follow people as that institution was closed. The money would follow people who needed those services back to the communities. And I think that's what we're continuing to struggle with, is how does that money go out, and is it adequate to provide housing? When Susan speaks of not being eligible for housing, I think, Susan, you're actually talking about eligibility for Section 8 voucher specifically, that's what's so hard to become a priority for when you are not homeless.
That's one type of eligibility for people with disabilities to become eligible for the housing provided through home and community-based services,
Mhm.
to be able to be placed with a shared living provider.
Is also
They have to be
homeless as well. Okay. So briefly, this opening slide is a project we've done with Pathways, which is for people, young people struggling with schizophrenia. It's under construction as we speak. The Champlain Housing Trust actually provided the site and the building for it. Among the projects that we funded is this one in Morrisville, and this just speaks to our work after the closure of the Grandin Training School in providing and the real downsizing of Waterbury, that also the state hospital took place in terms of working with communities with disabilities over time. This is a project that is now under construction. It's a development, 26 units in downtown Waterbury. For those of you old enough to remember, it's where Rusty Parker, WVV's morning man for 40 years, used to live, and for whom the park in Waterbury is named. And 3 of the apartments are being reserved for people with intellectual disability and developmental disabilities.
Yes, just to ask, the last slide, I didn't see it in time here. It was 311 million invested in more than 800 houses.
$31 million. Yeah, not 311 million.
Oh,
And who are those people that are eligible?
All kinds of different, this just speaks to after the Waterbury was downsized and Brandon closed, 52 individuals with intellectual disabilities, 162 units for people struggling with mental illness, and 46 units specifically for people with severe physical mobility issues. Specifically projects to serve those communities. In our general housing work, we've always supported various groups of people with disabilities, but this was built for those populations specifically.
I've got a quick question, Gus. Can you go back just for a second? So 52 plus 162 plus 46 out of the 800 housing units, is that right?
That's what, yes,
So
Yes,
plus 275 or 260.
250.
What's it?
yeah.
250.
Yeah.
250. Thank you.
So as was stated, Act 186 provided planning funds for 3 pilot projects. We've awarded about $3.8 million to help advance these projects. The Waterbury one is one of them, and it is for people who will be living independently, but there's also provision for staff, overnight staff in the building with their own unit. This is the building that is going to be, along with an addition that Champlain Housing Trust will be building for, in terms of providing 10 independent apartments, as I understand it, plus housing for 2 staff folks as well, being built in Burlington this year on an existing site that CHT owns, but will be an addition built in order to provide the housing. So some people, as Susan said, want to be in urban areas, and that's what they need. Upper Valley Services is the developer here, along with Downstreet Housing to provide this site close to their offices in Randolph. And this is the place where we really got clear on the 2-person rule, because it really directed what the development was going to need to be and made it very, very expensive. And then finally, this is the project Susan talked about in Moncton. And when I went to meet with the parents group, they still didn't have their 501c3, but they had one member of their group that made a huge donation to the project. They found this home that was on the market. It had been used as somebody's second home for years, and it had 4 bedrooms and 4 bathrooms. And that's and this is for a population which needs somebody to be on site round the clock. I
think we had the executive director of that home come and testify, yeah.
And she worked on a similar community in Hardwick. And their goal on this site, which is very rural, is to develop 3 more homes on the site. So we were able to help them take out their debt with the grant we made, which will allow them to begin to work on the second home they want to build on this site. So that's what's happened up to now. We're happy to be part of this study group. One of the things that I'm glad to see that Dale will be on it. When I had my last meeting with the parents group and the council, I asked, do we have a breakdown of how much housing we need in each county or which communities? And they said that information hasn't been available. So I don't know if anybody from Dale's in the room, but I think in order to develop a plan, we're going to need that kind of data to really come up with an effective plan. This is not going to be, even with changes in the rules, a low-cost undertaking. What the parents group wants, and they should want, is places that anyone loves would want to live in. And so even if we only need 300 units of housing to house the population, or 250, depending, or 200, we also need to be able to provide, in many cases, for people who would be living on site who will support these folks. So while the number of people with disabilities is one number, the number of care providers is a different number that also will need to be housed on site. I need to say that in the Riverflow project, what people are going to work for in terms of their room and board is extraordinarily generous. That model is working both in Hardwick and in other places around the country, but they're not making very much money. They're getting
The support services.
I think the other thing that's going to be really important, if we figure out how to make this work, is the bricks and mortar is one issue. How you operate a building, how you support people in it, provide the services, provide for the cost of operating the housing, even if it's debt-free, is going to be a second issue that really is going to need to make sure we're figuring out, especially in a time where all the assumptions we make about federal support and Medicaid are going to come under discussion.
Elizabeth, you had a question. And
I do. It's a very quick question. But the way my mind works is that I get hung up on something so can you go back to that one slide? Sorry. That's the one. Okay, so that was $31 million was specifically for the 250 units or was it for the 800 units?
Yes, I think I can speak to that a little
Go ahead.
bit. I think what you're seeing here, apologies, is some quirks of our database. So this is data we pulled actually a couple of years ago, and I'm remembering the details here. I think the 31 is attached to the projects that produced those 800 units, all of which had some aspect that allowed them to serve this population following the closure of Brandon. Within that 800, there were some projects that were very specifically targeted to certain populations. And so you see those examples called out below. So the number of units, the 52 plus the 162 plus the 46, that's not adding up to 800. And that's because that's just examples of very targeted projects that when we did a search of how many projects have the kind of word psychiatric in them that's allowing those to be coded that way, that's what's coming up. So you're really seeing examples, and then you're seeing the broad sweep of anything that any homes we built in that time period that had some aspect that allowed them to serve Vermonters with intellectual disabilities, developmental disabilities, and severe mobility issues.
Okay, so just so I understand completely, I'm gonna repeat back to you what I understand. The $31 million was for these specialized units,
No.
or the $31 million was for the 800 units, of which roughly 250.
Yes.
Yes.
Okay.
Yeah, there are probably also within that $31 million, there may have been projects serving, for instance, survivors of domestic violence. There were probably a few projects for Committee on Temporary Shelter. So that range includes all the various supportive housing. These numbers are calling out people who were
I
specifically
got you.
were dealing with disabilities as part of. Now, whether other people with other needs also fell into those categories, we can't tell you.
Thank you. I appreciate your patience.
No, that's we're always happy to clarify.
So my slide is two more.
It's not that you can't complain we're not paying attention.
No, it's great. I always rather have questions.
So of the 10, you said 10 units and 2 staff members.
Yes,
So does that, the 2 staff members takes of that 10, so there's really only 8?
I believe it's 12.
Okay. And then my other question is, near Fanny Allen in Colchester, there's some units there. What's the target as far as people that are eligible for those homes, those apartments?
Well, there's a whole lot of housing near Fanny Allen that we've funded. So one of them is a property that was built in the early 90s for people with AIDS. So I'm not sure if you're referring to that one.
What's the most recent one in the last year?
Recovery, yeah, there's recovery housing at 40th and Allen. Not far from Fanny Allen. I believe there's also project owned by Steps. Yeah,
Chris Donnelly with the Champlain Housing Trust. There's on Route 15, there is a shelter that's Steps owned or Steps operated shelter with 21 capacity for 21 families. There's also a brand new project we may be talking about, which are 3 dorms that are being converted into apartments.
That's right off of College.
It's
College Park. What is that called?
Ethan Allen.
Okay. How many units are in that area?
That whole area, I don't know how many people live in that. It's a large neighborhood.
Is it 1 and 2 bedroom?
In the 65 apartments that we're doing, there are 1 bedroom efficiencies.
And what category must you be in to be eligible for those apartments?
Those are income eligible. I think roughly 20 of those apartments of the 65 apartments that we're creating right now will be reserved for people exiting homelessness.
Okay.
Any other questions of Gus before we move on? Yes.
I'm confused because, the 2-person cap and then these like 40-person or 26-person homes. So
So one, the rules have changed over time. Two, I think that this facility is more for people with psychiatric disabilities than for people with developmental disabilities.
Okay.
Although there are some people who are dealing with both.
Oh, okay.
And somebody like Chair Wood could give you a treatise on, because she was at AHS when Brandon closed and had a critical, maybe the prominent role in how that rollout was going to happen. The model has changed over time, or the models have changed over time. So a lot of what we did actually the first couple of years was to help the designated agencies buy buildings that people moved into. And then they said, we don't like this model. And I think that was a reflection of the development of rules and some people not finding group living to be to their liking. And I think Chair Wood could give you much more. I've spent some time with her, but she's really an expert in this area in terms of what are the needs of families, what are the needs of the residents themselves, and the evolution of those rules. Having said that, 2 to a house will make everything we do more expensive.
I just want to clarify at the end, just to make sure that we get it straight. So there is a large, I'm trying to get terminology straight. There's a large group of people who need supportive housing, which simply means we're not just building units that people can rent, but they need some sort of service or assistance or physical situation that is different than people who, of the rest of the population.
That's correct.
And that supportive housing can include many different kinds of need for support. One of those kinds is people with intellectual and developmental disabilities.
That's right. And that was the population that was housed at the Brandon Training School and around whom this parents group has organized and been advocating for. And the reason that the funding for the pilot studies was created, and then we moved in with that good work to say, okay, let's get some of these operational and learn from it.
And as to intellectual and developmental disabilities, is a person who has no physical disability, no intellectual disability in the sense of a low IQ for whatever reason, but let's say is schizophrenic to the point where they can't function. Is that person considered part of the intellectual and developmental disability category?
You're funny, no friend.
This is beyond my expertise.
I cannot believe I asked you a question you do not know the answer to. Okay, go on.
I was simple. I build the house.
Yeah.
Mr. Chair, Susan Aronoff from the Development Disabilities Council. Every state defines people with disabilities different. So someone with a developmental disability in Vermont would not include someone with cerebral palsy. Someone with a developmental disability in Kansas absolutely would include cerebral palsy because it happens before developmental stage ends, which
Right.
is. So in some states, the waivers, every state gets its Medicaid waiver based on certain populations. In Vermont, we've created silos that are pretty high, walls that are pretty high between people with mental health diagnoses and people with intellectual and developmental disabilities.
Okay,
So there is a program run by the Department of Mental Health for people who are entitled to home and community-based services. They interestingly get some Section 8 waivers, our folks don't
so
get those. And they have some group homes, they have other resources in DMH that the department that Gail never developed. And part of that is the nature of the conditions makes some of the housing different. So people with developmental disabilities, transitional housing isn't really a thing. People don't transition out of Down syndrome.
right, yeah,
So on the mental health side,
They
they've
might.
had a lot of transitional housing
Right.
efforts.
Thank you. It's complicated. I
It
understand.
is.
All right.
And the same designated end agencies deal with both populations. And there are people who are dually diagnosed.
Thank you. Any other questions? Yes.
Is developing these units, is there a gigantic NIMBY problem?
I would say to you, in general, these projects have the Waterbury project faced opposition. I don't think because of people with intellectual and developmental disabilities being part of the project, but it did face opposition. The Homes Act was a great help when the Development Review Board in Waterbury initially voted not to allow it to be permitted, and then they saw what you wrote in that law, and they changed their vote, and it was permitted. So NIMBYism in general is a problem. I don't think that this population has the same difficulty that people who are, when you're trying to plan for and site shelter, that's usually something more. But there are regular affordable housing projects. We have one in Greensboro right now where there's a lot of people who are just upsetting Greensboro about building 16 units of affordable housing, even though the town hall, which is going to be the site, they've neglected for many years. Now there's signs all over town saying save the town hall. So we'll see how that comes out. So NIMBYism is a problem. I don't think it's necessarily targeted at this population.
Thank you.
Yes.
Mr. Chair, I would be remiss. We have one request for an addition to the bill, which was to add the stipend language for the people, their stipend language for the legislators on the committee, but not for the people who aren't otherwise paid. So I know there's some basic boilerplate language for that, just so the folks from DDHI and Greenbelt.
We can do that. It has budgetary implications, just letting you know.
And this may be more Susan's issue than mine, but in my experience, it's really hard to get these committees to function really well in the summer. And so November 15th is going to come really quickly, and you may want to think about making the date a little bit later. But if Susan feels strongly it ought to be November 15th.
That actually, we've been putting November 15th on these things because we want to try to actually make the December 1st deadline for legislative council for new bills. If it was a committee bill, there wouldn't be a deadline, but if it's an individual bill, there would. My experience has been that committees simply extend it. We can extend the deadline, but there it is. Any other questions of Gus? Thank you so much. Much appreciated. I want to ask the committee, do you want to take a break? You haven't had a break. Do you want to take a 5-minute break? We are at the point now where we're going to start our brownfields, and we're going to have 3 witnesses, Michael O'Grady, Matt Chapman, who's here, and Kathy Byer, who is she testifying remotely? Kathy will be joining us when she joins us. Do you want a break or shall we just continue? What's the will of the committee? We could take a 5-minute break. Sure. Let's take a 5-minute break where we can be